All right, again, our main focus will be all right. So now the way I'm going to teach you guys is so you can really nice and go step by step, especially when it comes to just understanding the abdomen, how to do the assessment of the abdomen, how to do the purcussion, how to do the auscultation, focusing on some of those GII issue, understanding different quadrants, so you can nice and be able to nice and understand this a little bit much more in depth rather than just on the surface. So we're going to be focusing on assessment, focusing on purcussion, focusing on auscultation, right? All right, so where do we want to start? Let's focus on the assessment first. So now when we are talking about assessing the abdomen, so now we're looking about just the physiological. So like whenever you're looking at someone's abdomen, what do you see? So let me use the blue one this time. Talking about assessment. So what do you see? That's the first one. Give me a second. All right. So if I say, what do you see? For example, is it flat? So that means when that individual is laying down, facing the ceiling, is the belly, is it flat? Talking about linear. Is it scaffold or scaphoid? When we're talking about the concavity. So scaffold right there. Is it protuberant? So now this is when we're talking about beer belly. Or when we're talking about ascites. And when we're talking about ascites, which is all about just nice and fluid accumulation inside the abdomen. So that's the first thing I'm looking at. I'm assessing. Is it flat? Scaffold. Is it concave? Concave. Is it protuberant? Nice and black, beer belly, right there. So we're still under assessment. So now what am I looking at? I'm looking at the umbilical. Is the umbilical, is it midline? Very, very important. So this will be the first one. I'm just going to nice and put that right here. Umbilical, midline. Is it midline? Very important. So now I'm looking at what? The ear distribution. So why is ear distribution very important? Especially when we're talking about circulation, because especially for individuals with type 2 diabetic, basically around the peripheral area towards the leg, that's when you see those shiny leg, and there's no enough blood flow in that area, so they are relatively bored in that area. So that means they don't really have ear in that area due to blood circulation, absence of blood circulation. So very, very important when you are talking about assessing. Is the belly flat? Is it scaffold? For scaffold, this is what you see in a more of a malnourished individual. Malnourished individual for a scaphoid. Then for protuberant, that's more of like beer belly or somebody with ascites. And ascites can be a sign of what? Think to your cardiovascular, heart failure. Which type of heart failure? Right side heart failure. All right, so now we already go through the assessment. So does this make sense right now? Which is we understanding the abdomen. So you understand what do you see and understanding the air distribution as well as the umbilical. So now let's go to what? Purcussion. So I'm going to use, let me use black on purcussion. All right, but here's what we're going to do. Before we get to purcussion, let's understand the quadrant of the abdomen. I think that would be a good segue. So hopefully you can see me on this side. So now when we are talking about the abdomen, so I'm going to start with just my 4 quadrants. All right, let me check my camera to make sure I'm still within frame. All right, perfect. All right, so right here, so this is my anatomical position. So that means on this side, that will be my right side. So I'm going to do right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. All right, this is the best way to remember majority of those organs in this area. So I'm going to be using black since I know black will be much more sharp, especially with the camera. Look at my anatomical position. On my right side, on this side, it's a little bit different than the right side. When you are looking more on the left, this is where the stomach is located on the left side. So now let's go to the right side. So on the right side, the liver is much more pronounced on the right upper quadrant. So now the liver will be right here. Then underneath the liver is what? Gallbladder. All right, so now from the gallbladder, that's when we start focusing on what? Duodenum. So now we know those intestine, you have the ascending, then you have the transverse on that same upper quadrant. So now we're going to have the transverse. So which will be right? Transverse colon. Then we have the ascending. Colon. So then on that same side, that's where you have your what? Your right kidney. Then on that same side, that's when you have the what? We know the pancreas is located right here, but majority of the pancreas is towards the left side, but the tail of pancreas is located right here on the upper quadrant. So now let's go back. We already got majority right there. So now let's go to the lower quadrant. So now when we're talking about the lower quadrant, that's when we're talking about the what? The ileocecum. We're going to get back to that, especially when we're talking about the auscultation. Talking about the appendix. Talking about the right Oh, disregard. Let's disregard that kidney right here on the upper. So you have the right ureter. Then you also have the right ovary. Ovary right there. Hope that makes sense. So now when we go into the left upper quadrant, thinking about what I mentioned right there, that's when you have your stomach. Underneath that stomach, that's when you have your what? Your spleen. That's when you have your what? Left transverse colon. Because now we know we go from the right to ascending, transverse, then what do you expect right there? Descending. So you have your descending colon in that area. So now let's go to the lower. The most important thing you have to know right there on the lower is your what? Sigmoid colon. Very, very important. So that's when you have your what? Your left ureter. You have your left ovary. And when you look at this, especially when I'm talking about all these lists, this is not just limited to this. There are more. There are more. So these are just the basic one that you should know. Basic one you should know, especially that for your exam or for your test. All right, very, very important. So now let's go for purcussion. So when we are talking about purcussion, we're talking about just nice and see, hear, just nice and listening to what is going on inside those abdomen. So whenever we're doing purcussion, typically it's very, very important to nice and always start from the what? The lower right quadrant and just nice and walk away in a clockwise direction. Even during auscultation, you also want to start from your lower right quadrant and just nice and walk your way. Because we're going to talk about that. Don't let me get ahead of myself when it comes to auscultation. All right, so now when we're talking about auscultation, what type of sound should you expect? So there should be about 3 different types of sound. You should expect timpani, timpani. Oh, it should be TY. Timpani, hyper resonance, and the last one is what? Dull. Dullness. Those are the 3 sounds you should be expecting. Timpani will be more of a normal sound that you are expecting. So basically, whenever you are doing your purcussion, usually use my middle finger, just nice and press, starting from the lower, press on it, and I'm just nice and tapping. Just like that. You can see, adding that pressure, just like that. All right. So the reason why you hear timpani, think about just the hollow, especially when we're talking about the organs in that area. More of like hollow, those organs are usually hollow, like spaces in there. That's why you hear those timpani. When we're talking about hyper resonance. So this is when we're talking about gas. Maybe there is gas in that area from what? Constipation. That can create hyperresonance sound. So when you're going to hear that sound, it's going to be much more distinct compared to timpani. So now when we're talking about dullness, this is the type of sound you hear over fluid, especially with ascites, or sometimes you hear that around those solid organs, like on top of the liver. Like especially around the upper, if I go a little bit higher, that will be more of like dull sound because now I'm on top of the liver. So I hope you understand that. Purcussion, timpani, hyper-resonant, and dullness. And you can also find fluid that will be more of like ascites in that area. Hope that makes sense. Hope I'm not going too fast. All right, so now let's go to auscultation. I'm just nice and do my short acronym for auscultation. So now when we're talking about auscultation with your T-scope, stethoscope, when you're talking about auscultation, we're listening to what? Bowel sound. Bowel movement. That's what we're listening to. And we know when we're talking about the right lower quadrant, where the ileocecal is located, you should ensure that you're hearing a bowel sound. So now where should you start your auscultation? Your auscultation should always start on the what? Right. Start auscultation on the right lower quadrant. So now whenever you're doing your auscultation, we're listening to three things. We're listening to bowel sound. But now the rate of the bowel sound and how you are going to categorize those bowel sounds will be based on three categories. We have what? Normal, active. We have hyper active. We have hypo active. And we have silent. All right. Before I start talking about normal active, hyperactive, hypoactive, let's talk about silent. Why is silent bowel sound dangerous? I want you to think about that. I'm not going to give you the answer. So typically, if you are not hearing a bowel sound, you have to make sure you listen for how many minutes? 5 minutes for you to nice and categorize it as silent. Listen for 5 whole minutes. If you haven't listened to 5 minutes, you haven't listened to the bowel sound for 5 minutes, that will be categorized as silence. That's why it's very, very important to keep this time in mind. Very, very important. All right. So now when we're talking about normal active bowel sound. So normal active bowel sound, this is when we are expecting between 5 to 30 bowel sound in a minute. So 1 minute. So that's what we are expecting. We're expecting that gurgling bowel sound inside that area. Hope that makes sense. All right. So hyperactive. So you know what that means. So that means the bowel sound is a little bit much more greater than what? 30. So greater than 30 bowel sound. And when we're talking about hypoactive, this is more of lower. Maybe we're talking about less than 5. That would be hypoactive. So there is something going on in there, but it's not normal because we're not getting between that 5 to 30, and it's not what? Absent. So we're getting less than 5. Hope that makes sense. All right, so then there's one more. I think I missed that one. So when we go from assessment, it should be what? Palpation. So what are we going to do? Where are we going to write that? Let's go more right here. All right, so when we are talking about palpation, 2 things I want you to remember. We're talking about soft, or let's just call it light. Palpation, and we're talking about deep palpation. So when we're talking about light palpation, so that means I'm just nice and feeling for what? For lumps, for masses. That's what I'm feeling as I'm palpating. You can see I'm just nice and going around, making sure I'm feeling everything, feeling for any lumps, feeling for any pain in that area. So then I'm asking my patient, how are you feeling? Do you feel any sharp pain in that area? They're like, no. So that's when we're going to go into deep. So when we're talking about deep palpation, maybe about 5 to 8 centimeters. So I'm just nice and pressing a little bit much more deeper. But in this case, so you can see for light palpation, we're looking for masses. We're looking for more of like pain, looking for lumps. So just more of that. But now when we're doing a deep palpation, what are we checking? We're checking more for enlarged organ. That's what we're checking. Enlarged organs. Very, very important. That's what I'm checking for, deep palpation. And you still want to ask to see if the patient is nice and feeling the pain. When you're doing your light palpation, you're also nice and observing the face of the patient, because sometimes the patient might be afraid to say something. But now when you are doing that light palpation and they are making that faces, or they're nice and guarding, like instead of relaxing, they are nice and guarding those abdomen, then you're like, oh, maybe they are feeling some pain. That's when you want to nice and call the attention of the patient to that. All right, so now the last one that we need to talk about is, what is it? Rebound tenderness. So when we're talking about rebound tenderness, this is when we are talking about, okay, do they have, it's typically caused with like an enlarged organs that create pain when pressure is removed. So now how do you check for rebound tenderness? So what I'm doing, closer to the coastal angle, I'm nice and pressing deeper, then I'm removing my hand quickly. If an individual have a positive rebound tenderness, as I'm pressing, this will relieve them, they won't have any pain. But as I take my hand off, then they're going to start having pain in that area. So that's how you check for rebound tenderness in that area. All right, hope everything makes sense, especially regarding the abdomen. So again, this is just like a quick overview for just like a quick study. Or after you study and just nice and see like, oh, do I really get everything I study? Oh, do I understand assessment, palpation, purcussion, auscultation? Is it, whenever I'm talking about purcussion, what am I listening for? Is it tympani? Is it hyperresonant? Is it dull? What is the difference between all those three? When I'm talking about auscultation, what am I listening for? If I can't hear no vowel sound, does that mean there is absence of vowel sound, or do I need to listen for 5 minutes before this can be documented as no vowel sound? And you want to call the doctor attention right away, especially after listening for 5 minutes and you don't hear no vowel sound. That should be an emergency right there. Then you also want to see, for my assessment, what am I looking for? Is he flat? Is he protuberant? Is he scaffold? And whenever I'm doing my observation, is the umbilical, is it midline? When I'm taking the ear distribution, what is going on in that area? So very, very important, just nice and understand the abdomen in a nutshell, so as to nice and aid you in your study for abdomen. Hope that makes sense. If this makes sense, make sure you subscribe and comment. Thank you so much, and I'm going to see you on the next one.